Hi, I'm Erica Sood. I'm a pediatric psychologist at No More Children's Health, and I'm going to be talking about the Normalize, Ask, Pause, Connect, or NAPC technique for starting discussions about emotional health. The first step is to normalize emotional experiences. By normalizing, we're communicating that emotional difficulties are common and expected in a given situation. We're setting up the discussion so that the easy answer is actually to acknowledge these common emotional difficulties, and we minimize the likelihood of the common "I'm fine" response when patients and families may not actually be fine. So, for example, I might start the conversation by saying, I know from working with other patients that it's really common to feel down or depressed when in the hospital. Or, many people tell me that a diagnosis of a heart condition makes everyone in the family feel more anxious. Or, I hear from a lot of families that they've had to grieve the loss of the idea of the healthy child. Or, I always ask about anxiety because how you're doing emotionally is just as important as how you're doing physically. The next step is to ask how the patient or family is doing. When we ask, we use open-ended questions, and we avoid checklist-like questions like, are you depressed? Are you anxious? Where it's pretty clear that we don't really care too much about the answer. In general, I would say less is more. We really want the patient and family member to do most of the talking rather than us as the clinicians. And it's important that we pay attention to our nonverbal communication. So try to make eye contact, face the patient, try not to look at your computer or have your hand on the door while you're asking these questions. So for example, after normalizing common emotional reactions, I might say, how about you? Or how have you been affected? Or, what's this experience been like for you? Or how are you doing? How are you feeling? And then you pause. By pausing, this communicates that you actually want to hear the answer and you're not just being polite. And it gives the patient time to gather their thoughts and decide whether to share. This might actually be the first time they've ever been asked this question in this way in a clinic visit like this. And it may take a minute to think about, do I feel safe sharing? Is this something I want to share right now? They likely didn't come prepared to the visit to talk about this. Try it again the next time. Even if patient or family member chooses not to share, it may be that they go home and think about it and come back to the next appointment ready to share what their experiences are with you. The last step is to connect. And connect can mean many different things. So it might mean kind of that connection between you and the patient or family member. So by using reflection and supportive statements, you can communicate that their feelings are normal and okay, and you can thank them for sharing with you. And that can actually strengthen the connection and the relationship that you have with that patient or family. Inquire about existing supports and encourage use of these supports. So these might be things that the patient or family member actually has available to them or they've used in the past, but maybe haven't used in a while, like peer-to-peer support. And when available, connect the patient or family member with professionals who can offer additional resources. So if you have a social worker or a case manager in your clinic or your setting, see if you can make that connection. That person may know of additional resources that could be helpful to the patient or family member. So for example, I might say, thank you for sharing. It sounds like this has been a really hard time. Or it makes a lot of sense that you feel this way. Or who have you been able to talk to about these feelings? Have you talked with anyone else who's been through this? Or we have a social worker who meets with many of our patients to discuss supports that may be helpful. Would you be open to meeting with them? So clinicians often have a number of concerns about initiating these conversations. And one might be, if I ask this question, that conversation will never end and my clinic will get behind and I'll open Pandora's box. And I think, most of the time what you're going to hear is the tip of the iceberg. So patients and family members often won't initially share their life story with you. They're going to share little bits and pieces and see kind of how you react. And does it feel safe? And is it something that they might want to share again? But there might be some situations where the conversation is very lengthy and it is difficult, within the confines of a clinic visit. And in those cases, use reflection. Let the family know that you've heard them and that you're listening and that you thank them for sharing with you, and then refocus the conversation on available supports. So for example, it sounds like things have been really tough. What's been helpful in getting through this, if anything? Or I'm so sorry to hear that things have been so difficult. I really appreciate you sharing this with me. We have a social worker who meets with many of our families. Would you be open to meeting with them? So again, you're acknowledging the work that it takes for someone to share all of this information with you. You're thanking them for that. And then you're refocusing on the supports that may be available for that family. Clinicians might say, I don't have the answers. I don't have the resources. I can't fix this. So it's better if I don't ask. And what I would say to that is asking and listening is an intervention in itself. It's actually a big part of what mental health professionals do. We ask questions. We want to understand the lived experiences of our patients and their families, and we listen and we validate and we normalize. That in itself can be helpful for supporting mental health, for people to understand that they're not alone in how they're feeling and what they're feeling is okay. And others have felt that way too. Also, consider who may have information that you might not have about resources and offer to make this connection. Some clinicians might say, but I don't know how to respond. When patients and families share this type of information, I don't know what to say. So again, reflect, normalize, communicate that it's okay to talk about this. It's okay to show emotion. Thank them for sharing. In general, I would say try to stay away from comments that might imply that they have to be strong or they are strong, because sometimes people feel like, when they're told that they're strong, that means that they can't cry and they shouldn't be feeling these emotions. And it can also feel kind of invalidating. Thank them for sharing. Ask about available supports that are available to them, and then connect them with someone who has the information if possible. Some clinicians will say, but it'll feel awkward. Like, I don't really know how to have this kind of conversation. And what I would say to that is, most people are having this type of conversation with their family and friends, right? It's, you're asking somebody in your life how they're doing, and waiting to hear the answer. And so it's not that different. You care about your patients, and asking your patient or their family member, how are things going? This must be really tough. How's it been for you? Is not something that's probably so far out of what you might do in another context. So don't overthink it. Start early in the relationship when possible. If you start at the time of diagnosis or soon after, then patients and family members just see this as part of the standard clinic visit, and they come to expect it. And it doesn't seem, unusual or abnormal to be asked these types of questions in the clinic setting. And for relationships that you've had for a long time with patients, that you've had since before you started asking these types of questions, just describe it as a practice change. Say, we've learned a lot about the impact that that chronic illness can have on patients and families emotionally. And so now I'm asking everyone kind of how they're doing, because I think it's really important. There's a lot of areas where we have practice changes in medicine and clinical care, and this is really no different. We've learned something new, and now we're assessing it. So thank you so much for listening, and I hope that the Normalize, Ask, Pause, Connect technique is helpful for you.